And we are live. Welcome back from our wonderful little break to Just Massage Therapist podcast, where we are just massage therapists. These are just our opinions. Of course, we're much more than just massage therapists, but these are just our opinions. um, so, if you are, as usual, joining us on YouTube, then you'll be able to see us and chat and stuff right in the chat. We'll be able to see it right away. If you're joining us on Instagram, then I do have to go back and forth. So if I don't get back to you right away, apologies. But we will see your chat and we will comment back. As you notice, it's a new time. We're doing this mornings instead. We needed our evenings, our Saturday evenings back, so we've decided to move it to Saturday mornings.
More time for you to watch it on the day.
Exactly. All right, I'm just waiting for the go live on the Instagram to actually work, and then yeah, everything will be good. So, Cora, what are we talking about today?
We're talking about cold therapy today.
Yeah, it feels like the right day to talk about cold.
Yeah, definitely is.
The right day, the right month, and oh my gosh, I woke up this morning and I was like, "Oh, why is it burr?" And then I realized that we left the windows open because we like to snuggle in the covers.
Mm.
But then when I wake up and I'm not snuggled with anybody, it's like, "Nah, this is cold."
See, that's like actually one of my favorite ways to sleep in the winter is like 8 blankets and the window wide open. It's hard to get out of bed, but
That.
oh, the sleep is nice.
Yeah, sleep is very lovely when it's cold outside, but you're nice and warm.
Yes.
Mhm.
Yeah, it's like kind of like camping, you know?
Oh, I love
That
camping.
cold outside.
If you're watching this later on or anything, you should comment down whether or not you also like the cold with the nice warm blankets, or if you prefer it to be warm so you can throw blankets off. Because it's always one of two camps that way.
Yeah, see, for me, my feet have to be covered because
Oh,
I've seen well, my childhood fears still run rampant in my adult life. So if my feet are covered, nothing can grab them.
I got you. Yes.
Yeah.
Yep.
That's what it is.
Oh, that's funny. But that is not the cold we came to talk about
No.
today.
No, that's just way too many horror movies and an overactive imagination.
Oh, my gosh. Oh, the horror movies. So we're talking more about the actual use of cold in therapy
Mhm.
today
Right.
and how cold can be beneficial, sometimes not so beneficial. Cora, you are our foremost authority on hydrotherapy. So why don't you talk a little bit about what you think about cold therapy?
Well, I think cold is very very beneficial when it comes to overall tissue health. I feel like when we think of cold, we immediately think of an acute injury, like you bonked your head, put cold on it. I know that's like the go-to for a lot of kids, especially mine. They're like, I need an ice pack, and that's all well and good, but it actually extends beyond that to just general maintenance of tissue health, promoting circulation, strengthening the tissues and the blood vessels. Um, and then also back to that acute stage, there's a very fine line when with with the tissue healing when it's beneficial and when it's actually not anymore.
Mm.
And I think that that's something that's kind of gray between a lot of people too. Because once you get to that certain stage of healing, like once you're into that subacute, you don't want just cold anymore. You want to start adding that heat. So if you're constantly using cold because it hurts, it's not actually doing what you think it's doing necessarily.
So what do you think it is doing?
Well, I feel like if you're using cold constantly, it actually is decreasing the amount of blood flow in the area. I know with Chinese medicine, they don't really use cold; they use the heat. And with some of the articles that I have read with heat versus cold, the cold is actually starting to work its way out, or the ice particularly is starting to work its way out as far as the treatment of injury. They've noticed actually an increase in chronic pain associated with prolonged use of an ice pack, just because
Mm.
it does decrease that blood flow to the area to the point where the macrophages aren't able to come in and do their cleanup. So there's
Okay.
a lot of cellular debris, dead tissues that are still, or dead cells still stuck there, not able to actually be flushed out because they're not actually utilizing the heat to really help promote new blood flow to the area. With that
That's
being said,
really cool.
yeah, I thought it was really interesting also. Like it's fairly fresh, like only within the last like 5 years have they actually start to weed out, like determine is cold actually better or is it detrimental? Like, but it definitely is. I don't think it's detrimental because it does promote the body's own reflexes in returning blood to the area, which is very important, especially when you're dealing with, chronically cold feet or poor circulation to the hands. That cold therapy is going to make the body work to return blood to the area and promote circulation, strengthening those blood vessels, in promoting um, immune system function by kind of increasing the production of red blood cells because of that decrease in oxygen, that temporary decrease in oxygen to the area. And it's also going to promote new tissue, new blood coming to the area, which is going to do the cleanup that's needed for tissue health.
So that kind of takes us over to the idea of the cold plunges and everything, because what it sounds like is you're promoting it, or you're thinking of it more of you already have mostly healthy tissue, maybe just not great circulation.
Well, there's that too. And then also, I was also reading an article with those cold plunges and the relationship to the circadian rhythm.
Ooh.
They actually found too, like majority of heart attacks actually happen in the shower. And it's usually early morning and it's a cold shower. So the body's going through its reheating phase and we're doing that cold shock to it. And the circulatory system just kind of gets overloaded. So I think that there's a lot of missing pieces in relation to those cold plunges. And I think that education is very important and more research is very much necessary to determine whether those cold plunges are actually as beneficial as people say they are, or if it's more related to the body's natural heating and cooling phases.
That is really cool. So doing it sort of around its natural cooling phase would be more beneficial, you think, than its natural heating phase.
Right. Or at least, or not the first heating phase. If it was during a second reheating phase, then that would be different than that very first one because everything's waking up.
That's really cool. One of the things that I loved, and I still do actually, I haven't been able to do it as often since I've moved, but is doing the full body reps, the cold full body reps, which is like a mild cold plunge, right? Because you're getting into something that's really cold and then your body is reheating it. I found that it was really good for circulation. So what you're saying is try to be thoughtful of when you use cold.
That's just it. And when you actually look into the theory of it, like when we taught it, there were like the times of frames for the cold wraps were in relation to that circadian rhythm.
Oh, really?
They were, yeah, because you would always want to do it during the like later in the day. You didn't want to ever do it first thing in the morning. There was no cold indication that I remember teaching that indicated first thing in the morning was a good idea.
No, that's pretty cool. Yeah, I'd definitely forgotten all about that part. That's so funny. Uh, so what are your thoughts then on ice massage? Because, ice massage is used as part of our regular treatments for certain conditions or certain things. How does the research that you've read change your mind or not change your mind?
It doesn't really because we're actively creating an inflammatory process that could get out of control. potentially, because we're using it after frictions, we're using it after high intensity treatments. So that ice massage is there to kind of calm everything down. And there's a rule with the ice massage. We have our CBAN. So, and there's those stages that we are watching for. And if we skip any of those stages, like the cold, burning, aching, or numb, then that indicates a negative reaction. So we're watching for that as RMTs or as practitioners. We're watching for those stages, and we know that if any of those get missed, that we have a negative reaction and their body's not responding the way it's supposed to. And then at that point, it should be aborted. It's not like somebody putting an ice pack on their arm for more than 2 minutes, more than 5 minutes, because people do. And then that comes down to the rules, right? The duration of cold.
Yeah.
Because if something like ice, your body's not actually able to heat it up. If you're using, right? So that's a huge difference there too, because you're not actually promoting that circulation. You're actually promoting prolonged ischemia or a decrease in oxygen. You're promoting that prolonged decrease in temperature, which could eventually result in frostbite. So,
and I think that's a thing that not a lot of people think about or know to think about, honestly, when it comes to the cold treatments, is what kind of cold are you using? Because if you are using ice, it's true. You can't, your body is like, okay, well, ice doesn't stop being ice, doesn't stop being cold, right? Until it's gone. So your body can't reheat that. No matter how hard it would try, it can't reheat it. So it's going to consistently be closing off those blood vessels in that area. Right? Like, I don't know, many of you that watch, you've likely looked at capillary beds if you're a massage therapist, or if you're joining us and you just want to learn some fun stuff. Our capillary beds are a big network, each one of them, each place where the blood goes from being, our red blood to our blue blood, right? Our oxygenated to deoxygenated blood. It's a big network of little vessels that are allowing for the exchange of oxygen and carbon dioxide and other things. But they all have little sphincters that can close them off, except for the one line that goes from the arteriole to the venule. There's one line that can never get closed off, but the rest of them can. When you put ice on an area, all of those close off. And you just have one line that is allowing for the movement of oxygen and carbon dioxide. So you've taken a network of, say, 2 dozen capillary openings to one. So if you want the actual visual of just how much you have the capacity in that area to have hundreds of capillaries, and each of those hundreds of capillaries have a dozen to 2 dozen networks that allow them to release oxygen and take up carbon dioxide and all the other stuff that happens, all the debris and all the glucose and nutrients that are needed. And then each one of those, say, 100 that are there, you put the ice on there, and now you only have 100.
Yeah, that's just it.
Instead of 100 times 12, you only have 100. So now your oxygen movement capacity is greatly reduced by, a dozen by 12. It's greatly reduced by 12. And then if you just go by the dozen, and then the ability to take up debris or carbon dioxide, the stuff that might sit there and really harm the area because it's debris that your body doesn't want there, it just gets left there. Doing that for 1 minute to 2 minutes, even up to 5 with an ice thing on there, you could get away with it. 5 is a little much, right?
Be your absolute max.
Yeah, be your absolute max. 1 minute to 2 minutes, awesome. Right? Because all you're trying to do is create ischemia in the area so that you have a lack of pain and the swelling starts to go down a little bit. That's really all you're looking for. And then you've got to take that away so that the capillaries can reopen and start moving things again, like really moving.
Yeah. And that's really, and that's something too that it's important to be aware of, in that also, like, that temporary decrease in oxygen kind of panics the kidneys too. So it's beneficial because then you get that red blood cell production, which
Thank you.
increases the promotion of oxygen.
Which I
So
think is where the cold plunges. That's where I think the cold plunges are actually a really fantastic thing.
if done in the right time, and I think also it depends on, and more isn't always better. And I think that's the thing too. Like, if you're not good with cold, don't go straight to an ice plunge. Like, and that's where people are, I feel like they see those cold plunges and they think immediately ice water. So there's a difference. Like, there's a temperature and you have to work your way up to those extremes. And I personally feel like, turning like a cold, like tap cold, is okay as long as you're able to adjust and you know that how your body's going to respond. But if you've never done it before and you immediately jump into that cold plunge, you're going to shock your system.
Yeah. They used to use that as a treatment for people in insane asylums, and yeah, it was not a great thing.
No, I don't imagine it.
Oh, that's the other thing that a lot of people I don't think about is you have to make sure that you're warm before you go in.
Mm-hmm.
If you're not warm before you go in, if you're already cold, you're not getting any benefit at all.
No, that's a rule. Do not put cold on a cold body.
Mm-hmm. I can remember back, oh God, this would be almost 20 years ago now. Whew, that's so funny. I used to have really, really bad circulation, specifically down to my feet, and I followed all the correct steps. I made sure that they were warm and stuff, and for about a week to 2 weeks, I did cold water stork walking. We call it water treading, but you put cold water up to like mid calf or so, and you walk in it. You take one foot fully out, and then down, and the other foot fully out, and then down. And you do that for like 30 seconds. I did that every day for a couple of weeks, making sure my feet were warm before I went in. And I haven't had a lot of problems with my circulation since then. And I just did it for a couple of weeks. I think it was like a week and a half because I got lazy. But I haven't had a lot of problems since then. That was at least 15 years ago, maybe closer to 20.
And that's amazing.
Yeah.
Like that vasoconstriction, and then that body's own warming up, right? Because you didn't go into anything warm after that, right? You just went for a walk.
Yeah, no, I just went for a walk. I usually did it in the like midday-ish. Right? And then yeah, I continued about my day.
Yeah, and that's where it's very beneficial too.
Mm-hmm.
Like, that's where cold can really work to be our friend. And that's the purpose of it. Like, that's the reasoning behind cold therapy, is to strengthen those circulatory blood vessels and allow for the veins to work better, and the arterioles to work better, because in all reality, the veins kind of have the crap end of the stick, or the short end of the stick, because they have to work against gravity.
And they don't have as much smooth muscle.
And they don't have that smooth muscle. So they need that constriction to help push everything back up. And then with that too, you also have that muscle contraction, which is further promoting that constriction, that vasoconstriction.
What do you think it's doing to our lymphatics?
I think that it is promoting lymphatic circulation too, because it's not just the capillaries that, or not just our capillaries that are undergoing vasoconstriction. The lymphatic capillaries will be too. So overall, that's how it would indirectly affect immunity, because it would also increase that the function of the white blood cells, making them more active. It would help direct them to the lymph nodes where they can actually be screened and filtered.
Mm-hmm. I love the visual. Maybe I'll try and find it, but I love the visual of the insides of the walls of arteries, arterioles, venules, veins, and then the lymphatics, because you can see the muscular arteries there is so much smooth muscle in those guys. My gosh, it is packed with smooth muscle. The lumen, the hole in the middle is tiny because there's so much smooth muscle. And then you get to your later arteries and your arterioles, and you see that smooth muscle start to pull back a little bit, but there's still quite a bit of smooth muscle. And then after the capillaries, it's like, where did it all go? There's one tiny little layer.
And then you get valves.
And then you get the little valve. And then I look at the lymph capillaries and I'm like, there's not even a full layer in the lymph capillaries. Like around the whole lumen, it's not even a full layer the whole time.
Mm-hmm.
Sometimes there are places where there is no muscle. There's little gaps where there's no smooth muscle in the lymph like the lymph vessels. And it's like, oh my gosh, so that's why. Right? Like it has to go slower because it does have to move. It has to be big and it has to move bigger things through it. But it's like, yeah, I can see why the cold would be helpful because even with the small amount of smooth muscle, it'll constrict it as much as it can when you add that cold to it and start pushing everything upwards.
Well, and it's not just the capillaries or the vessels that are constricting, it's also the muscle, right? And then lymphatics are so superficial that as that skin tightens and the muscles tighten, it would restrict them.
Yep. Yep. All that crazy smooth muscle. For those of you who are unaware of the differences between our muscle tissue, we have three kinds of major muscle tissue. We've got our skeletal muscles. Those are the ones that we mostly consciously control. I'd say maybe like 30% we consciously control, honestly, let's be honest. But, everybody thinks biceps and triceps and all those wonderful muscles. And then you have your smooth muscle, which you find in your blood vessels and in your organs, and it helps to move things completely involuntary. We can't voluntarily think and move those ourselves, right? We can do things that will help them move more or less, but we can't voluntarily go, okay, descending aorta, I need you to contract now.
Yeah, right. If only. Yeah. I'd be a bit more concerned when my daughter holds her breath if that was the case.
Yeah, let's not do that. And then, of course, there's the heart.
A whole new level.
Then there's the cardiac muscle, which is all the muscles that surround your heart and everything. I have a fun question for you. What do you think that the cold is doing for the gut?
It is going to be stimulating it.
Okay, what does that mean for the people who don't know what that means?
It kind of wakes it up because the way it works, right? Because cold shuns blood away from the area. So you put cold on the extremities, the body goes into panic mode, and all the blood goes to the core. So when the blood goes to the core, that is promoting digestive functions, that is increasing just overall organ function in general. And then with the heat, blood is coming out to the periphery because the blood vessels are dilating. So that brings blood away from the core. So that's actually going to do the opposite. So if you really want to wake up the gut, you should put cold. But that's actually another thing that with that surge of blood or that increase in blood to the core, high blood pressure will spike. So that's another thing to be aware of as far as conditions go and the use of cold.
Mm-hmm. You don't want to be using a lot of cold therapy with someone who has high blood pressure. Even if it's controlled high blood pressure, you want to be mild cold. You don't want to be the extremes of cold, right? And you have to be really aware with people who are pregnant, people who have diabetes, right? People who've gone through chemotherapy or radiation. There's the body's reaction in the extremities very different now.
Yep.
Very different now. Next week I have a story for that because next week we're talking hot. So I'll bring that up next week. But it's freaking awesome. Right. But I've known a number of people with diabetes, and you try to do cold therapy on the lower limb specifically, especially if you try to do like calf wraps or anything like that. You have to be super careful because they're likely going into a like every day they're getting closer and closer to not having proper sensation in their feet, right? Their feet, their hands, especially the feet. It seems like it always attacks there first.
Do you think it's because it's like furthest from the brain?
Yeah, and it's the closest to the ground where everything's being pulled down to, right? So it honestly, our feet get battered. They really do. They get battered the most. I also think that the lower limb, because everything in the lower limb, the nerves that are coming from it, all get their cell bodies, especially their motor cell bodies. They're all clustered in the same region near the like connection between the thoracic and lumbar region,
Mm-hmm.
right? Because from there, it's just nerves that are coming out. It's not the actual cord anymore. It's nerves.
Yeah.
So all of that stuff gets clustered, and I think we have more problems with our lower limbs than our upper limbs because we have a cluster of nerves that are or nerve cell bodies that are all just in one or two segments. Instead of everywhere else where there's not clusters of one or two segments, everywhere else has its own segment.
Mm. So then, okay, and then we also have a like low back glute tension too. It's a pretty common thing. So that would also probably contribute to that too, hey?
Oh, that would be a fun, like, whole thing to do. Find pictures and show you what it all looks like because it's something that we don't consciously think about when we have people who come in with lower body pain,
Mm-hmm.
right? Is those nerves I feel are working double time because they have to fight against all the other nerve cell bodies that are there. Like there's not a lot of room.
Yeah.
Makes you
Like,
wonder a little bit about sciatica.
yeah, hey, I was just gonna say, like that could be one of those kind of ahas, like maybe when we're so focused on that piriformis and we're focused on like the problem areas where the symptoms are, I wonder if maybe something as simple as like a sacral decompression or intentional movement could actually make more of a difference than manual manipulation.
Yeah. I mean, and even just looking at the positioning of the ribs, because it goes as high as the lower ribs, the floating ribs.
Mm,
It can go as high as the floating ribs, and are those floating ribs out? They're the easiest ones to get out.
yeah,
This is so much
all
fun. But
things.
do you put cold on the lower back ever?
Sometimes, like not usually, but I definitely will, especially if somebody has something like lots of edema or there's really they're really congested or bloated. I will use that cold more like as a heating compress though. So I'll put it cold and I'll make the body warm it up.
Yeah.
I personally don't use a lot of ice in my treatment. I don't really suggest a lot of ice either. I'll
No.
usually go with like ice water with a cold cloth, like put the cloth in the ice water, and then when it's no longer cold, replace it
Mm-hmm.
kind of with those cold compresses. Like that's more so what I promote with my clients because it's more manageable and the risk of a negative reaction is less.
Yeah. I've stopped putting cold on lower backs
Why so?
completely because of the nerves.
Oh, I see.
Yeah, I've stopped putting cold on there anywhere close to the spine at all. I no longer promote cold there unless I've done frictions, in which
Mm,
case I will do ice massage there, and then I will immediately warm the area up
yeah.
right after. Right? But yeah, no, I don't put. I'll put cold on the front of the trunk, but the low back particularly because those nerves are fighting a lot. Like
Yeah.
I shouldn't say they're fighting. They're not fighting to survive or anything. They're programmed and made to survive in that atmosphere, but I don't want to put any more strain or stress on them by putting cold on the lower back.
Well, and that kind of makes sense because they are the fight or flight,
Mhm.
right? Those nerves in the lumbosacral plexus, they are going to kick that bear or run. So cold is very stimulating. So I could see how that would kind of wake everything up and stress them out a little bit.
Yeah, it's so funny with the fight or flight versus rest and digest, we talk about the sacral nerves are rest or digest, and the, you know, and you've got the thoracic region that are more fight or flight, but they're still within two segments of each other. They're cell bodies.
Well, and then the sciatic nerve is a fight or flight.
Which is so weird because it comes out of L4, 5, S1, 2, 3, 4, which are
Right.
supposed to be more rest and digest.
Yeah, there's always, that's the thing with the body, man. You have your rules, and then you have the curveballs.
Which is, sometimes I think there are more curveballs than rules.
So depending on what you're talking about, but yeah, there are a lot of curveballs. A lot of curveballs.
Oh, that's so funny.
They drive me batty sometimes. Some of them are like, yeah, that one's cool. But most of the time, like, you suck. Why can't you follow our rule?
Yeah, follow the rule, you dum-dum.
Better.
So what do you think? Is cold the gold that is that they say it is right now, or is it not the gold that they say it is? What do you think?
I think if it's used responsibly, it is. There's a lot of benefit to cold therapies, and I am not against cold therapies at all. I just think that the education needs to be there, and the information needs to be present with all of these new treatments that come through that become fads.
Yeah. Well, isn't that the truth every time?
Well, that's just it, because cold is really good. Like, it's good for like mental awareness. It'll wake you up. Like, during exams, I would dry brush and cold all the time. That's what it was. Cold, dry brush, cold mitten friction. That's what I would do to wake myself up for exams, kind of even before studying. That's what I would do. And that would wake me up, and it was beneficial and it was good, but it was used responsibly. And there's a lot of people too that have underlying conditions, and the education is not there. So in that situation, like Raynaud's, right? If you don't know you have it necessarily, you just have cold feet, but cold is good for you. All of a sudden your feet are so sore and you don't know why. Well, it's because you're not educated in what Raynaud's actually is. And it's more than just poor circulation. Or things like, even with heart problems, like it increases circulation. It's really good for your circulatory system. It is. But if you have a circulatory pathology, it's not.
It's not. It's awful for you, actually.
Yeah. So I think that that's just where the big flaw is in the cold aspect of things, because you have these fads, and they come out in all the ways, like cupping, all the fad diets that come out, all these fad treatments, but the education is not there. The contraindications are not there, or your cautions aren't there. And then the indications, or why they're good for you, are so general.
Yeah, they don't go into the specifics enough.
That's right. And that's where there's a big flaw too. Like, I was also reading, like, when I was doing boat safety, a majority of drowning is because when you fall off the boat, the water is cold, you seize. You can't swim if you don't have a life jacket on. And that is one of the leading causes of drowning, actually, is the inability to actually function.
Because it's so cold, your body just goes, nope.
And that's a thing too that it's really important to be aware of, especially when you are doing cold plunges. Like in the Arctic, like in the Northwest Territories, they do the lake perch, they do the lake run during the thawing. They'll like run into the thawing river, and then they'll run back out, and then they have a big bonfire after. And that's one of those where, yeah, okay, there is benefit to that, especially if your body is conditioned to it. But don't go jump off a dock.
No.
And expect it to be okay. Like, it's a slow run where you can still touch, and there's people around you that can help.
That one.
Yeah.
Like, make sure if you ever do any of this stuff that you are not alone. Right.
Strength in numbers, always. Safety in numbers.
Yeah. I have one more question for you. The cold, not the cold plunge, but the cold rooms where you go in, you have the tunic and the mitts, and you're wearing your shoes, and then they blast you with the cold for like 30 seconds. What do you think of those? I want to know your thoughts.
Personally, my first reaction to that is gross. But again, as long as you're immediate, like you have your 30-second time frame, as long as there's that communication there. And you do have your protective coverings, like your mitts and your toque and your gloves. And as long as, again, there's that communication and you are listening, because it'd be follow the same rules: cold, burning, aching, numb. Same rules.
Mhm.
And that is very much my guideline with cold. Whatever you're doing, make sure you're going through those stages. Because if you're not going through those stages, your body is not reacting properly.
You're right. You should feel cold, and then you should have a feeling of burning. That's pretty normal feeling while everything is it'll start to ache because the body is trying to push into that region where all of the blood vessels are constricted and short. That's where the aching comes from. And then you should go numb. Your nerves should just give up. As soon as you go numb,
You're done.
you're done.
And like another thing to really watch out for, like, I guess you can't really see, but I'm really cold too, but I don't know if you can, not a little bit. I don't know if you can see kind of like that hyperpigmentation, the blotchies.
Mm-hmm.
This is like a negative reaction. That's what it looks like. That's a negative reaction to cold. So that's another thing to be very aware of. If you do have, like, I'm just in my house right now and I'm having that reaction. So I personally do not respond very well to cold treatments because of my reaction to the cold. And that's something to be aware of too. If you do have those negative reactions, cold is not for you. It is not for you. You can maybe go to like cool, work your way out, see how you adjust as your body adapts to the different temperatures. But for me, extremes in temperature, they are not good for me.
Mm-hmm.
Like, either way.
It is very different.
So.
All right. Well, I hope you guys learned a lot today, especially with the Sea-Band. I think that's probably the biggest takeaway, honestly. The biggest takeaway is knowing what you're supposed to be feeling and when to stop those feelings. I think that's the hugest part about cold. And I think that, personally, I think that cold is gold, but it's only gold when you are being safe, right? Just like mining for gold, you have to be safe while mining for gold. You have to be safe while using cold.
Yes, I completely support that statement.
Yeah, pretty good. All right. So if you wish, you can see down below here, you've got our places where you can find us. CNC Learning Hub, of course, is going to be the business itself. Cora has her own with Cora Peters RMT. I have my own, Just a Massage Therapist. These guys are all on Instagram. And I believe Facebook. You have yours on Facebook as well, right?
Yeah.
The Just Massage Therapist is not on Facebook. I literally never go on there.
Learning Hub is.
Oh yeah, CNC Learning Hub and Cora both are. So if you want to go ahead and follow us there, that'd be great. Otherwise, this is good. That was a good chat, and I'm glad to be back from our winter break, our Christmas Eve break. And
Happy New Year, by the way.
Yeah, Happy New Year, everybody. Next week we'll be talking about the opposite. We'll be talking about heat therapy.
That's where I like heat a lot more than cold.
Yeah, I like them both. I use them both quite often. Yeah. All right. Cool. We will see you in the next video.
Bye.